Are you active like me and want to keep up some sort of exercise routine throughout your breast cancer treatment? This video will take you through 4 lower body exercises that you can do in the early stages after surgery. If you're watching this video and you're further out from surgery, or maybe you haven't been as active lately, then these exercises would be great to start back with. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Upper body exercises will be limited initially, of course, after surgery, other than your shoulder rehab. But you can certainly continue doing lower body exercises at this stage. The exercises in this video are basic and safe to do even at the early stages after surgery. They're isolating movements to the lower body only, so they don't involve any activation of the upper body. I started these exercises a few days after my double mastectomy and then again after my implant-based reconstruction surgery. You don't need to start as early as I did, but if you want to, it's safe to do. I had low back pain after both surgeries, and that's one of the reasons why I started exercises so early. If you had deep reconstruction, you'll have to wait longer to start these exercises because of your abdominal incision. The typical positions for doing exercises will need to be modified at this stage. You'll be avoiding lying on your stomach for obvious reasons, but also avoiding lying on your side because of drains. You may be able to do some exercises lying on your back, but the exercises in this video are all standing, so they should be doable at this stage. The first exercise is a side leg raise, and you're going to keep your leg straight for this one. In a standing position, you can raise your leg out to the side, keeping it in line with your body. Try to avoid rotating your leg outward so that your toes would be pointing up to the ceiling. Instead, think of lifting your leg, leading with your outer heel to the ceiling so that your foot would actually be level. There's a tendency to lean over to the side to raise the leg higher. Try to keep your body upright, as your leg doesn't need to be raised very high for this exercise to be effective. You should feel this exercise in your outer hip or glute area. The second exercise is a side leg raise again, but this time you're going to keep your leg bent. This exercise will activate your glute in a slightly different way, but you'll still likely feel it in that outer hip area. There's also a tendency with this exercise to lean over to the side in an effort to raise your leg higher. Try to keep upright as with the previous exercise. The third exercise is hip extension with a straight leg. While standing upright, you're going to raise your leg to the back, keeping your leg straight throughout this movement. You'll want to avoid leaning forward too much to raise the leg higher, as only a small amount of movement is required to be effective. You'll also be less likely to aggravate your back if you're not leaning so far forward. You can think about activating your abdominal muscles throughout this movement to help with this. You should feel this exercise in your butt or glute muscles in the back, but you shouldn't feel any pain in your low back at all. Consider hitting that subscribe button if you'd like more recovery tips or exercises after breast cancer surgery. The last exercise is hip extension again, but this time with a bent leg. You can think of pushing your heel towards the back wall and squeezing your glute as you raise your leg. You'll feel this exercise in the glute like the last exercise, but also in your hamstring muscle or back of the thigh. You shouldn't feel any low back pain with this exercise either. Try to avoid lifting the leg too high and overextending your back. Again, keep those abs activated throughout this exercise to help with this. I hope these exercises will help to get you active again wherever you are in your breast cancer treatment. Thanks for watching, and see you in the next video.